Hi, today I'm going to demonstrate an orthopedic exam on Reggie. Reggie is a 28-year-old Morgan gelding owned by the Minor Institute over in Chazy, New York. Before I get started, I want to make sure that I have all of the equipment that I need. It's pretty basic. I want a hoof pick to make sure that I can clean out the bottom of their hoof. And I'm also going to use a pair of hoof testers, which you can pick up a cheap pair at a farm store, or you can get a nicer pair depending on how often you're going to be using them. So before I actually touch Reggie, approach him in any way, I'm going to ask for a history. If he's my own horse, I'm going to know that right away. But if he is, somebody else in the barn's horse, or if I'm a veterinarian and it's a client's horse, then I'm going to ask questions such as what's his pertinent history? Has he had any lameness in the past? Has it been going on for a long time, or is it pretty acute? Did they notice any sort of injury when it happened? And so forth, just to try to get an idea of maybe what's been going on with him and what might be going on today. So after history, I'm going to observe Reggie from a distance, just like we do with our physical examination. This time I'm focusing on his musculoskeletal system. Do I see anything obvious? Is he standing on all four legs, bearing weight equally on all four of them, or is he sort of shifting from side to side? Is he holding one of them up, appearing to not be interested in standing on it all the way? Do I see any lacerations, any obvious swelling, anything like that that might be causing him problems? From there, I'm going to start to approach him. And just like our physical exam, I'm going to do that from the head and then move my way back. Usually the left side first and then down the right side. So we'll do that next. So our focus is the musculoskeletal system. So that is going to include all of the bones of the skeleton and then the muscles that overlay them. And then once we get down to the distal limb, that's going to be focusing on those tendons and ligaments that the horse has down there. A horse doesn't have any big muscles from sort of the carcass down and from the hop down. So I don't spend any time really on their head with an orthopedic exam. You do want to make sure the horse isn't neurologic. Sometimes a neurologic horse might appear to be lame when in fact it's something that's going on in their brain, spinal cord, and nerves. But as long as they seem to be aware of where they are in space and not stumbling, then I'm going to focus just on that musculoskeletal system. And I'm going to start by palpating the cervical vertebrae. So here, sort of working my way down, making sure I don't feel any obvious swellings. Here, from the withers, I've got my scapula. I can feel the spine of the scapula running down to this point of the shoulder. Then I can feel that shoulder joint, make sure I don't feel any effusion or increased fluid within that joint. Come down, feel our humerus here, which is a big, thick bone, sort of buried under a bunch of muscle. Back to this elbow joint. I can feel the olecranon, or the back part of that ulna there. Make sure, again, I don't feel any effusion. Coming down, we've got the radius and the ulna. The ulna ends about 2/3, 3/4 of the way down. No obvious swelling or discomfort. Here's the carpus that has all the different carpal bones. Working our way down, this is going to be the cannon bone, or metacarpal 3, with the medial and lateral splint, just running my hands down those to make sure I don't feel anything obvious. To the fetlock joint, the long pastern, the short pastern. So we've got the fetlock joint itself, we've got the proximal interphalangeal joint, and the distal interphalangeal joint, or coffin joint. I'm not going to be able to palpate very well, but if it had a fusion in it, I might feel some increased fluid here at that coronary band. And then I'm going to make sure I feel the front of the hoof, feel for any heat. And then lastly, I'm going to take my fingers and feel for that digital pulse on the medial and lateral palmar digital arteries, just to make sure it's normal and not bounding or increased. After I've run my hands from the top of the forelimb down to the bottom, then I'm going to go ahead and pick up his limb. And then I'm going to sort of check for range of motion overall, right? Is he able to flex and extend each of those joints? This also gives me an opportunity to feel in those carpal joints, right? So we've got the radiocarpal joint, the midcarpal joint, and then the metacarpal joint down here. Again, I'm just feeling for a fusion or increased synovial fluid there. And then while I have the limb up like this, I'm gonna take my not dominant hand, so my left hand, and then I'm gonna palpate the flexor tendons and the suspensory ligament that run from the back of the carpus down towards this fetlock. And the one that's gonna be closest to the skin, that I'm gonna be able to get my fingers around, that's going to be the superficial digital flexor tendon. I'm gonna kind of start at the top and squeeze and work my way down just to see if he reacts to it, if I feel any swelling. And then underneath that, I can feel the deep digital flexor tendon. I kind of feel probably about the thickness of a hot dog, but a little bit flatter or more squished. And then I can push those aside, and the last structure I'm gonna feel here coursing all the way down is gonna be the suspensory ligament. And horses sometimes can be reactive to this. I like to think that it's sort of ticklish to them. So you might get a horse that pulls away, but if it's consistent, they continually pull away every time that you do it, then that could be concerning. There's a check ligament in here. I could see if there was any sort of swelling, but to know for sure if it was causing a problem, I need an ultrasound. And then down here, we've got some distal sesamoidean ligaments that I can't necessarily isolate them out specifically. And if there was a problem, I'd want to get out an ultrasound and look at them in more depth. The last thing I'm going to do on this forelimb is I'm going to do hoof testers. On his hoof, Reggie actually wears full pads underneath his shoes, so it makes it a little bit tricky. If I wanted to do a complete hoof testing exam, I would need to remove the shoe and remove the pad. But just for demonstration purposes today, I'm going to show you how you would go about doing hoof testers. So you would pick up the horse's foot. If it's dirty, you're going to pick it out around. Make sure you have a nice clean surface. And then you're going to pick up your hoof testers, step your inside leg over, and then I'm going to take my outside leg and sort of use it to support it. The idea is that then I have both of my hands free and I can use the hoof testers appropriately. So these hoof testers are really nice. They can stretch out to accommodate going across heels, going across the frog, and so forth. So I usually start with them pretty narrow, and I'm going to go around that sole, right at that sort of white line or solar margin. Then I can stretch them out, go across the heels, and if you didn't have a pad on, I could sort of go midway and kind of go across that frog. I do want to be really careful that the hoof tester itself is staying on the horse's hoof wall. You don't want to accidentally come up here and grab around the coronary band. That's sensitive and would cause damage to the horse. If a horse had an abscess or laminitis, or a fracture in that coffin bone or something like that, you would expect the horse to pull away or react to those hoof testers. Moving my way back, I'm going to now focus on the horse's back. We now know that horses can get kissing spine. We know that they can have muscles that get pulled along either side here. So what I usually do is a really basic exam where I kind of start at the withers and I squeeze. And then, using my hands, I'm actually going to focus on his back on the other side, and I'm going to take them and I'll place them there, and I'm going to kind of pull that musculature towards the spine and see if there's any area where he is reactive. That might mean him pulling away, it might mean him twitching, it might mean him sort of dropping down. And I'm going to come all the way back. It's okay, Reg. I'm going to come all the way back. Here's the sacroiliac joint. That can be a reactive area. He seems okay. And then when I'm on the right side, I would do the same thing. And then I can sort of take my hand and kind of run it down those spinous processes. If a horse was really painful, I might get a reaction there. But Reggie feels good. So now that I've done the forelimb and the back, I'm going to focus in on Reggie's hind limb. It's going to be similar to what I did with the forelimb. I'm going to palpate from top to bottom, then I'll pick up the limb, check that range of motion, test those flexor tendons as well as the ligaments see if I can get any kind of reaction. You do need to be more careful around a horse's hind limb. Just use your common sense. Keep a hand on them if they're fidgeting, just so they know where you are. Make sure you're not standing directly behind them, especially if you're leaning down low. It's an easy way to get injured, so just keep safety in mind. So up here, remember we've got the sacroiliac joint here. This is the horse's tuber coxae, which is the equivalent of your hip bone here. And then this is the horse's tuber ischii. So I use those landmarks, that tuber coxae and the tuber ischii. I come back about 2/3, I drop down, and I know that this is going to be my horse's hip joint, right? So where the pelvis is articulating with the horse's femur, right? And just like the humerus up front, the femur is a really, really big, thick bone that is going to go from this joint here, underneath all of this muscle, down here to the stifle joint. The stifle joint is the joint that horses like palpated the least, right? So you're most likely to get kicked by a horse when you're palpating their stifle joint, but do the best you can and be smart about it. So keep a hand on them. The stifle joint, a lot of people think it's right up here by the bottom of the flank, but it's actually a little bit further down, right? It is where the femur is coming together with the tibia. There's a patella, which is a sesamoid bone, just like your kneecap, that slides up and down. So when Reggie's not bearing weight on the leg, right, it's not up there in that position. And then the joint itself, and then around the patella, there's going to be several ligaments that you can palpate from the outside to the inside, as well as check the joint for fusion. This feels good. And then coming down from the stifle, right, you've got the tibia, the fibula in the horse is rudimentary, doesn't bear any weight, ends halfway down, so we don't worry about that a whole lot. We're going to come down, the tibia is going to come down all the way to the hock or the tarsus. Similar to the carpus in the front, it's made up of a bunch of different bones and different joints. Then we've got the metatarsal 3 or cannon bone with the medial and lateral splints on either side. And similar to the forelimb, we've got the fetlock, long pastern, short pastern, coffin bone, and the same joints there. Last thing to do on the hind limb is to pick it up. Again, you want to be careful. You always want to be facing towards the back of the horse. Ask him to pick it up. Give him a second. Scoot in a little bit closer. Here I'm going to be palpating those flexor tendons facing towards the back. It would not be safe for me to do it the other way, especially with the horse that's moving around. Feel that suspensory ligament. And then while I have him up here, let me see, Reg. Boy, I can do the same thing with the hoof testers, right? So here he doesn't actually have shoes on, so we can get a little better look. Take my hoof testers, go around that solar margin. Go across the heels and across the frog as well if we needed to. Our next part of the orthopedic exam is watching Reggie move. So we're going to do that in 2 ways. We're going to do it on a baseline, and then we're going to do it on a lunge line. So Molly's starting by walking him away from us. As he's walking away from us, this is our best chance to observe his hind end. We're going to see, does he pick his foot up, keep it in a straight path while it's in the air, and then land, or does he swing it in or out? And then she's going to walk back towards us. Now we're looking more at his forelimbs, see how they go. Next we'll have Reggie trot away from us. Here, looking at the hind limbs, we're looking for the rise and fall of that hip. We're looking to see, is it even, going up and down on either side, or is one side taking a further path? Here, as he's coming towards us, we're looking at the forelimbs, looking at his head. Is it going up and down or staying pretty steady? It's always nice to watch a horse from the side. Gives you a chance to see, is there one limb that is short-strided and the other side is playing catch-up? Or is the horse bringing both limbs forward equally? Are the hind limbs landing where the forelimbs just left? Or are they short-strided? So after the baseline, I like to put a horse on the lunge line. This changes the stress on the horse's body. Those inside limbs will be bearing more weight on the inside of the circle. The limbs on the outside will be going through more stretch. So some people like to think that a bone problem will get worse when the limbs on the inside. Soft tissue problem would get worse when the limbs on the outside. Here we ask the horse to start with the walk and then move up to the trot. Similar to the baseline, we're looking at the footfall, the overall stride length. We're looking at the head. Does the head go up higher or drop down lower? In any particular instance, if a horse is sore on one of the forelimbs, they're going to try to pull the head up and away when that limb is bearing weight, just to take some of that pressure off of it. So we talk about head up when laying down, or down on the sound, depending on how you see it. In the hind limb, you can tell Reggie here is short-strided, so he's not landing those hind feet where those forefeet just took off. Looks a little bit uncomfortable in that hind end. Oftentimes we'll ask the horse to canter, mostly because, not that I necessarily see lameness at the canter, but I want to see that upward transition, that downward transition. It can help you speed up a horse that's going a little too slow, especially that instance when they come back from the canter to the trot. You can see Reggie does have a little bit of a head bob. So he's a 28-year-old horse that's had some problems with his coffin joints, some arthritis in his hock, so he sort of travels like a 28-year-old horse. So with the lunge, you always want to make sure you go in both directions. This would be tracking right. Originally we had tracked left, just because different problems can get exacerbated in different directions, right? Because of that increased weight on the inside and increased stress or stretch on the outside limbs. So you always want to go both ways, see if the horse looks better one way over the other. That can help you try to figure out what's going on with your horse. The main reason that we are watching a move is trying to isolate it to a particular leg, and then we're going to next do some flexion exams to try to narrow it down on a particular leg, and then figure out what diagnostics we want to do if needed. Now that we watched him move on both baseline and the lunge line, now I'm going to do flexions on each individual limb to see if I can exacerbate soreness or lameness. So with the forelimb, there's 3 different flexions you can do. The first one's going to be the distal limb flexion, where I'm flexing the fetlock joint, the pastern joint, and the coffin joint. I'll put my hand on the inside of his forelimb, keep my knees bent, and then pull up. I want to be careful not to put my hand on the bottom of his foot, so that if he slams his foot down, my fingers don't get crushed. And then I'm going to pull up. And then normally I'm going to count for 45 seconds to a minute. And then the person who's got the lead rope, I'm going to give them a 5-second countdown and ask them to trot off. I'm seeing, can I make him more sore by stressing this area? So 5, 4, 3, 2, 1. Do we see increased head bob, soreness, anything letting us know that that was uncomfortable for Reggie? Working our way up, our next flexion is going to be the carpus. So I want to be careful not to flex that distal limb, so I'm going to put my hand on the front of the fetlock, the front of the cannon bone, and then I'm just going to lift up so that I'm flexing the carpus here. This one we usually hold for at least a minute and then trot the horse off. For demonstration purposes, I'm going to go ahead and have him jog off now so that you can see the countdown and having him take off. So 5, 4, 3, 2, 1. Again, looking for any sign of discomfort. Okay, our last forelimb flexion is going to be the upper limb flexion, where I'm going to flex both his shoulder and his elbow joint. So I go ahead and I pick up his limb. Sometimes horses think this one's a little funny. I'm going to hold on the back of his radius, so above his carpus, and I'm going to lift up as best as I can So ideally we do this for 45 seconds and then trot him off. So 5, 4, 3, 2, 1. Now moving on to the hind limb flexions. The distal limb flexion is going to be very similar to the one that I did in the forelimb, except for I'm going to hold my hands differently. Good boy. Again, it's a hind limb, so be safe. Reggie is short enough, my arms are long enough that I can go on the inside of the hop. Hold on to that hoof on either side. 45 seconds. Trot off. Here I'm looking for the hip going up and down. Normally a horse's hip should be even on the right and left side. If a horse's hip is coming up high or dropping down low, that usually indicates discomfort on that side. The last flexion in the hind limb is going to be the upper limb. So because of the reciprocal apparatus, we can't flex the horse's stifle without also flexing the horse's hock. So I'm going to go ahead and pick up his leg. Grab the back of the fetlock, get my legs sort of underneath me and kind of tucked up against his flank. Pull up so that I'm supporting the weight with my legs and not with my back. Hold for 45 seconds and then trot him off. So 5, 4, 3, 2, 1. And again, see, does it make him uncomfortable? Does it change his gait at all? So now that we have watched Reggie move on the baseline, on the lunge line, now that we've done our flexion exams, we've palpated him, we've manipulated him by pressing on the tendons, ligaments, doing the hook testers, then we kind of put the whole picture together and try to figure out where his soreness is coming from and then decide if we want to do any further diagnostics. Further diagnostics might include a radiograph or an x-ray, an ultrasound, a bone scan, a CT. We could do nerve blocks, so we could put in a numbing agent to try to block out the pain, to try to narrow it down even more specifically. So we have lots of options. It just depends on how much money and time you want to spend working up a lameness. Usually your veterinarian would be involved in this process and would help guide you. Today, Reggie looks pretty good for a 28-year-old horse, so we're going to let him go outside, have some fun with his friends, and continue to use him in light walk-trot work, which seems to be best for him. Thanks.